When I got my first cell phone, I had no idea how it worked. It seemed like magic, the future. Only what I learned is that it emits a kind of radiation, not the same as X-rays, but more like microwave ovens, only at a very, very low power. When there was a cell tower proposed at the local high school near me, the room was packed with parents and teachers and people who lived nearby, and they were all saying, we don't want to have that cell tower because of the radiation that they would be exposed to day and night. But what they don't realize is that in addition to cell towers, cell phones emit the same kind of radiation, and it's absorbed into our body actually quite intensely. So when you hold a phone up to your head, you're absorbing that radiation into your brain. If you carry the phone in your pocket, you're absorbing that radiation into your body. And if you carry the phone in your bra, like many women do, your breast is absorbing that radiation. But most people are completely unaware that their phones even emit radiation. They don't realize that the phone is connecting to the tower, and the tower is connecting to the phone. And it is the same kind of radiation. As a mother, I care about my kids' health and safety, just like other parents. And what parents need to know is that children are more vulnerable to cell phone and wireless radiation. They absorb it deeper into their brains compared to adults because they have thinner skulls, they have smaller heads, and more importantly, their brains are still developing, so they're more sensitive to cell phone radiation. When cell phones first came out, there wasn't a lot of science, but now there is, and not on some random website, but in academic journals, peer-reviewed, published studies by some of our nation's top experts. And what the science has shown is not just about cancer risk, but also brain damage, issues with memory, damage to reproductive organs and fertility. So what I say to people who are new to this issue is to reduce the radiation exposure. Keep the phone away from your head, away from your body, and especially away from children. I thought, of course, cell phones are perfectly safe. I mean, you can buy them at the store, and I assume that, of course, they were tested for safety. I assume that the federal health and safety agencies that I trust, that they were watching my back, that they had researched the issue, and that they were making sure that if the science showed harm, that, of course, they would take action. And I was really shocked to learn that none of the health and safety agencies, the FDA, the EPA, National Cancer Institute, none of them have researched all of the science. There is no agency that's in charge of, for example, cell towers. And here we are in a time of 5G where they're putting up cell towers right in front of our bedroom windows. And yet there is no health and safety agency that has reviewed the research on cell towers or even has authority in regards to cell towers. It's a supreme lack of accountability in our nation, and we need to fix this. We need to have accountability in our federal health and safety agencies and ensure that they protect people and, of course, the environment, because now science is showing impacts to wildlife, to our birds, bees, and trees. Members of Congress are writing constituents back, saying that the Food and Drug Administration is ensuring safety when it comes to 5G and cell tower radiation, even though the Food and Drug Administration has no authority when it comes to cell towers and 5G networks. They only deal with devices, and they haven't even looked at all of the science, such as impacts to the brain damage, damage to memory, also impacts to reproduction. They have not shown any reports on this issue.